Welcome to NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide the highest quality services. According to Eric Erickson, a noted developmental psychologist, every person must pass through a series of 8 interrelated stages over the entire life cycle. NCSS provides a continuum of services to meet the needs of individuals who at any point seek assistance. NCSS's purpose is creating a stronger community, one person at a time. Now, let's get to today's show.
I'm Joe Halco, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month on this program, we discuss a human services topic, and we do that with staff from one of our 3 service divisions. Our 3 service divisions are Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. And on occasion, we have guests from organizations that NCSS collaborates with throughout the year. This month's episode is titled School Avoidance and Truancy. The Franklin County Truancy Intervention Project is a multi-system effort to ensure that students access their education. Laurel Chen, NCSS's truancy specialist, began working to support individuals and families in January of 2015. She works closely with community partners to develop a consistent truancy response protocol through a tiered approach to construct individual plans of care that meet both the individual's needs and strengths. To discuss the important role that the Franklin County Truancy Intervention Project plays each day to promote social and emotional well-being through education for the children and families served, I'm pleased to introduce this month's guests. They are Laurel Chen, NCSS Truancy Specialist, Nina Curtis, Director of the Restorative Justice Center, and Joanne Wells, Assistant Director of Special Education for Franklin Central Supervisory Union. I'd like to welcome all of you to the show this month.
Thank you. Thank you, Joe.
So let's begin with, what is truancy?
Sure. So thanks again, Joe, for having us on the show.
Sure.
So truancy, the kind of broad definition is it's excessive absences from school. And the Vermont law, this Vermont truancy statute states that truancy is any absence from school that in which there's no notified cause to the school for that child's absence. So I like to also just label it as chronically absent. I think truancy has kind of a criminalized definition at times. And for the purpose of our project, when we're talking about truancy, we're usually talking about over 15 days of absence in a school year.
Okay. So to effectively address truancy, it takes the commitment and collaboration of numerous community partners. Who makes up the Franklin County Truancy Intervention Project team?
So this, Joe, this is a wonderful collaboration in Franklin County. So some of the players are local schools, administrators, and special ed team. We have NCSS, we have DCF, we have the Franklin Grand Isle Restorative Justice Center, we have state's attorneys. Jim Hughes has been coming to our meetings. And I think that's really it. We have school administrators, we have special ed directors and teams. So it's a wonderful way for the community to address the needs of children and families. It's really working so well.
If I could just ask, is this different than maybe any other part in the state of Vermont, or is this something that is being practiced in other parts of Vermont as well?
I think it varies across the state of Vermont, and there are a lot of different approaches, and we were really intentional in wanting to create an approach that was a problem-solving approach. So to not come in with a hammer to say we're going to prosecute you for not bringing or having your kids attend school, that we really wanted to take a look at what are the barriers, you know, what's getting in the way of students being able to attend. So again, it varies tremendously across the state.
I understand. Now, let's go to why do kids skip and miss school in Franklin and Grand Isle counties? I'm sure there's a variety of reasons, but what is...
A variety of factors. They're differing depending on the age of the child. One of the surprising factors for us was transportation, especially within this supervisory union. Homelessness is becoming a huge issue. Families are under stress, which is another reason to take a problem-solving approach. Sometimes it's health-related. Sometimes, again, it can be the families or children who are substance involved. As you know, that substance abuse is a factor in Franklin County as well. Social anxiety, unresolved bullying and harassment issues. So it's really a plethora of different reasons.
I would imagine. I'm sorry, Laura.
Oh yeah, and I would chime in that as Joanne said, it's a pretty complex kind of pot, and we think of like truancy as a symptom of other issues, whether it's the child's mental health, whether it's at the family level, whether it's at the societal level. And I meet with a lot of families and see that there's some sort of lack. And I mean, I guess you could call this poverty, but it may be a lack of, like Joanne says, transportation quality, even just quality healthcare, quality employment that's stable. And because of that, it's just that school is maybe on the back burner compared to these priorities that are more important for, you know, kind of the survival and sustenance of the family.
Sure.
I'd also say that mental health, especially as you get to the older grades and through high school, is a major need, and I think it's great that now most schools in the area do have either NCSS school-based clinicians or their own school-based clinicians. So mental health from past trauma or anxiety or depression is definitely something that's coming up as well.
So why is school attendance so important? We've talked about some of the factors of why students may not be there, but the importance of being in school.
Yeah.
There are a lot of predictors or research that's showing us that if our students don't learn to read by at least at the 3rd or 4th grade level, that they're 4 times more likely to drop out. They're 4 times more likely to become substance involved down the road. They're also more likely to engage in delinquent acts. The dropout piece is huge. And eventually, and there's a huge study on this, eventually the numbers of young people who are incarcerated can be traced back to truancy and not completing high school. So that's a big piece. And I think another piece that we don't always talk about, but it's the financial implications for our community down the road, because the students that we're working with aren't necessarily kids who are going to leave the community as adults. And so what does that mean? You know, what is the impact on their ability to work at jobs later on that are substantial and can sustain them?
Well, work at them, and then I think another part might be because of their history to successfully be at work each day. Are there other factors that are going to contribute to maybe that doesn't happen, which means they may have to job hop, and then you get into all the other aspects socially as well that one can incur.
Yeah, and I think that one other thing that I've noticed with some of the parents I'm working with is that school attendance, of course, like the focus is on the children, and the other thing that it does though is when children are at school, it allows parents the time, the space, the energy to focus on their own needs and not just the needs of their children. So thinking about, you know, generational, these kids who may not graduate high school may not be able to find viable employment. There's also the factor of if these kids are at home and there's a lot of struggles in the home during the day when the kids aren't at school, it doesn't allow parents that space and time and energy to also reach their full potential. And one thing we focused on in the Truancy intervention panel is looking at the lower grades. And Joanne already talked about like this idea of at third grade, due to absences, we can see a clear correlation. Even in kindergarten and first grade, 85% of kids who miss 18 days of school or more they're 85% less likely to read on grade level by third grade. And then that kind of goes into, if you're less likely to read on grade level, you're less likely to graduate. So it's interesting to communicate that to parents and schools about looking at kindergarten, first grade, so school throughout.
So it becomes harder and harder to catch up later.
Sure. Oh, yeah. I could totally understand that. So what happens in Vermont when a child misses excessive days of school?
So I can speak to Franklin County specifically. So the Truancy Intervention Panel worked to create a protocol, and that protocol is has been given to every school in Franklin County, and the idea is that every school will be on board with following the steps of the protocol. So each absence, whether it's excused or unexcused, is also counted as an absence. It was decided this year. And at 5 days, the school will call home, talk to a parent or guardian, and just check in, see what's going on. At 10 days, the school will invite a parent or guardian into the school to have a school attendance meeting to really say there's a pattern, we need to address it and see what's happening. And send home a letter as well. And at 15 days, if we get to 15 days, then the referral will be made to the Truancy intervention panel, at which point the TIP will meet and evaluate the case and see if a referral can be made. So the hope is that every school is following this protocol. We had one protocol last year. We looked at it based on working in this county for a year and working with schools, and we made some slight adjustments this year so that it would really be a smooth process that schools can kind of learn and work into their everyday system in contact with parents and homes.
Part of the work leading up to the development of this protocol was bringing together all of the superintendents in Franklin County in our region to explain to them what we wanted to do and how we wanted to do it so that we had their support going forward in this. And I think it's a bit unprecedented, at least for this county, that every school is utilizing the same protocol. And Grand Isle is not. They kind of pulled out of this and they have their own thing going on. But I think that was a big piece, was getting the support of all of the superintendents.
That was a big piece, and we're really pleased that it's a unified effort. It really is,
Yeah.
that we're serving the needs of the county sort of in an organized way. So it's working well.
Yeah, that is terrific that you have the whole county involved and all of the supervisory instead of a kind of a cookie cutter approach where
Right.
everybody's doing their own thing. It's a little different,
Right.
or not doing anything perhaps. The other thing I wanted to mention in listening to what you had to say, Nina, is that do most parents get on board with this as far as they're going down the track here and their child is, teetering on 5 days or 10 days, or you get to the 15th? Or do you find that parents aren't quite as engaged as you'd like them to be?
Well, I do think it varies, and I might let Laurel address that because she works so closely with the parents. I will say we hope for early intervention so that the referral is not made to the Truancy Intervention Panel, and that can happen, that often does happen. So that's the school intervention part, and they will address it directly with the family that they know, whether multiple kids have come through the system. But I will turn it over to you for that parent piece.
Yeah, I have to say that I've been happily surprised with the level of engagement with parents. And again, I can't quite speak to before they get to the 15 absences because that's when I start serving them.
Sure.
But there's a willingness when you approach it as like, this is a support, this isn't a punishment, of parents to engage. And I think, unfortunately, sometimes the parents do have, for whatever reason, have created a difficult relationship with the school. And I think sometimes I can act as that bridge, so that maybe if they weren't engaging with the school, there can be a different level of engagement. Now, of course, there are times where I haven't been able to engage with families, and that's why we might talk about this a little later, but the next step of the protocol is that there's a report made to DCF, and DCF can become involved. And again, we've created this system so that that's really the kind of last step, and we don't want that to happen as
Sure.
a whole, and we present that to parents, and I think that helps them engage at times. But there are cases where once I work with them and either interventions are clearly not working for this family or there's a lack of engagement, that's where DCF may become involved. And that's why it's wonderful to have Jen Harris. She comes to the table from DCF at our TIP meetings, our monthly Truancy Intervention Panel meetings, and we can give updates on those cases as well.
Well, it's interesting that you sort of mentioned that scenario, because next what I was going to ask is, if a child misses school and does this compromise educational neglect and removal from the home.
Sure.
And that, I know in some people's minds would be extremely scary to feel that because of this that the child would be removed at some point.
Yeah.
So it's possible that that could happen. I would say that that's the piece that we're trying to avoid. So it's not necessarily will happen. There is in Vermont statute what's called a CHINS D, and it's a child in need and care of supervision, and it's directly related to truancy. So that allows DCF to get involved. Generally, there are other safety or protective factors that are of concern to DCF for them to in addition to truancy. So it's possible, but generally there are other factors involved in that. There's a differing approach between Franklin County and how we're doing this in Grand Isle County, and I mentioned that before. We have a situation where we don't want to prosecute parents.
Sure.
That's
Sure.
not, and we have all of these other interventions in place to do that. We also don't want to overburden our family court system any more than it already is. Grand Isle has a situation where their sheriff is involved, the district attorney is involved, and the sitting judge. So they will file affidavits and bring parents before the court. So again, that's a last resort for us. But it's not just Grand Isle. I mean, there are other places in the state that operate that way as well. So in statute, in Vermont state statute, there is still on the books a $1,000 fine to prosecute parents for non-attending students. But again, that's not something that we utilize. Yeah.
Okay. Now, what are some of the effective interventions when addressing school avoidance and truancy?
So I think it'd be great for Joanne to talk at the school level, and then I can talk about when it gets to truancy specialist level, what some of those interventions look like.
So prior to making a referral, and Nina mentioned this, generally we went from sending letters at 5 days absence to actually personal contact and making phone calls. We really want to have a high level of communication with parents, because I think that's what leads to engagement and the problem solving piece. So we don't want to take a blaming approach. And so at the school level, most of our schools have homeschool coordinators who can engage parents and become involved in that way to see what is the issue, and is it something that we can address at the school level. Is it a medical or health issue? So in that case, what do we need to do to engage the parent, maybe the pediatrician, to look at what are the factors that are getting in the way. So there's a lot of work that's done prior to getting to the point where we were at the 15 days and then we're making the referral to Lauren.
Yeah, and so speaking about when it gets to my level, I think the wonderful thing is that because of this panel we have and the contacts with, between NCSS and education, it allows it so that when I start working with them, it can be somewhat seamless. And a lot of my interventions, I I guess it's a case by case basis, and I like the flexibility of it in that I can figure out what are really those contributing factors to truancy and how can we address those. So I can do some community work with the kids around coping skills if there's some anxiety or mental health issues. I can attend meetings with parents as sort of an advocate and to work with the school and the parent to make sure that the needs are being met, which the great thing is usually the school, or always the school, has already had some sort of plan in place for this child. So just to kind of check in on that. I can make referrals to NCSS, other clinicians at NCSS, and it's a lot of kind of intensive home-based work if it seems that the primary reason, or one of the primary reasons, is that it's just hard to get that kid out of the house, whether it's routines or limits that are difficult, or a chaotic life at home where school is not prioritized always. So again, it's case by case, and it really starts with, as Joanne said, developing that relationship with the caregivers, with the students, with the schools, and working in tandem to assess the nature of the factors, and then work with the student and family.
Mm-hmm. Okay. Now, let's discuss a case study
Sure.
that highlights how intervention has made a difference.
Yeah. So this, I've been working with a student at Richford Elementary School since it was late fall. So this, I'll just kind of give the background, is this student missed 11 days in September. There was some concern of homelessness, and not really, when it came to TIP, not really sure what was exactly going on. So I found that the contributing factors seem to be mom has a really tough undiagnosable health condition now that she's dealing with. There's not necessarily she had supports, a lot of friends and family in the area. Not those natural supports weren't being used for like transportation. And I think just because the parents both hadn't graduated high school, there was not necessarily a high level of value of education. And so to miss, it was a young kid, to miss 1 or 2 days per month seemed okay in the grand scheme of things. So the interventions for that is I worked with mom on some referrals for her health, attended some doctor's appointments to make sure that she was getting that in-home care that she needed. Helped her to kind of meet with her natural supports and figure out, all right, who is, on those days when mom is in the hospital, who is going to be there in the morning to get him ready for school, to get him to school. And then also I worked with the principal, which I thought it was amazing. The principal actually came to the house a couple of times for some home visits, and we talked about what is the value of this child being at school, and really looking at like his strengths at school, the progress he's been making, and why is it important and great for him to be at school. And the wonderful thing is, this was a kid, is still a kid who loves school, and the past 3 months, I think, he's missed 0 or 1 days. So it's a successful case, and it's actually a case that I'm about to say goodbye to, which is also can be a hard thing at the end.
Sure.
Yeah.
No, that's a terrific example of what can happen.
Mm-hmm.
Could we share another case that demonstrates how situations are different and the requirements for intervention would be completely different? Because as all of you have said, each of these are case by case, and there's always different factors that play into what you're dealing with.
Yeah, so whereas with the case in Richford, it was a lot of things that were keeping this kid at home. And with this case I'm going to share, it was actually things at school that were, when I say pushing out of school, I don't mean like aggressively, but there were things at school that she was anxious about. So she was avoiding going to school. The first one wasn't avoiding going to school, but he couldn't get there every day. This one she was avoiding due to anxiety, some bullying that happened previously in the year, and the school had actually really done a great job in addressing that, but she still had some concerns around her peers. And so that was this was an older child, that was a lot of more community-based work with her to develop coping skills, kind of meet her where she was at, which was hopefully at the school. So going to lunches with her, having lunches with her peers who she felt some concern around, and developing those positive relationships. And this was, she actually transitioned to high school, and I was able to work with her through the summer before that transition to ensure that she had those proper supports through Ashley Demers, who's a homeschool coordinator, and her guidance counselor. And so yeah, I was happy the first day of school. You know, I learned that she made 3 friends, and from there things, I think I discharged in October of last year. So it was a positive transition for her.
Well, that's great stuff. Now, to recap, let's take a look at the countywide truancy protocol, which details at what phase the Franklin County Truancy Intervention Project team members become involved in a case, because as all of you have said, there's various aspects to this that within certain points in time, certain organizations get involved.
Yeah.
So if we could just kind of recap
Sure.
in a nutshell what...
Absolutely, Jill. I mean, I will say that really local schools are there from day one. I mean, so we have, I believe, 2. We have Joanne, who's on the tip, and Eric Remmers, who's the principal of Venusburg High School. But really, schools play such a central role, as you know, in just keeping the communication open and the relationship positive with the child and family. So that's ongoing and all the time. And as you know, there's NCS staff in the schools, which is such a wonderful development. So that's an ongoing support structure as well. So I would say that those 2 are fairly constant. And then when the referral comes to the tip, that we meet once a month, I would say on average we have somewhere between 3 and sometimes more. So I think we've one time had 6. I mean, yeah. So say 3 to 6 referrals. K-8 mostly, but we have recently in this first part of the year been able to add a part-time person to work on high school truancy as well. So we and sometimes either principals or homeschool coordinators or guidance counselors or special ed member of special ed team will come in and sort of represent the case and talk about the case. So we often have school people coming into our monthly tip meetings. And at that point, we have a representative from DCF. Laurel had mentioned that, and the Restorative Justice Center is there, and the state's attorney. So at that point, the whole team will evaluate each of the referrals and have a conversation and look at all the factors. It's a pretty extensive sort of application referral process. And sometimes we need to go back to the school and ask additional questions of whomever that student's contact is in the school, and decide, well, this looks like a good referral, and Laurel is able to accept that person, or her caseload is as open. So I would say, really, to recap, the players are kind of involved at many and most of the stages of the process, especially the schools, and I would say and NCSS.
I think it's important to note as well that if a case is not accepted, then the TIP team will send recommendations back to the school for some other things to try.
Exactly.
Yeah.
So we want to know what interventions have already been tried
Sure,
before
absolutely.
that student arrives at the TIP panel. So it's a very thorough process. I mean, the protocol is really working well, and we couldn't do it without all the members of the collaboration. It's really phenomenal. It is, and I think it's representative of a lot of collaborative efforts in Franklin County. It's people who really care to make a difference and positive change. So.
Yes,
3 years in the making.
Your group certainly is a great example of collaboration locally.
Yes.
Well, I can't believe it, but our time's up already for this month, and I certainly want to thank all of you for being here. So I want to thank my guests, Laurel Chen, Nina Curtis, and Joanne Wells, for being on the show today and sharing their insights on the tremendous value that the Franklin County Truancy Intervention Project plays in the lives of students each day. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.
This has been another episode of NCSS Here for You. We hope that you found today's discussion informative and educational. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. Thanks once again for tuning in this month. NCSS's purpose remains creating a stronger community, one person at a time.